Several people continue to die and many others hospitalized following a cholera outbreak in most parts of the country. Northeastern, Eastern and Nyanza provinces are hardest hit. Lack of infrastructure, poor sanitation, use of unsafe water from the shallow wells and lack of toilets in areas are some of the factors that have led to increase of cholera cases.
The bacteria that causes cholera enters the body when you ingest food or water which is contaminated with feces. That is stools which have either leaked into the water or the food, and this gets into the body.
It is also in these areas where maintaining good sanitation is at its lowest.
Telling people that they need to drink clean water sounds like a myth to them, because they don't even have the fuel to boil the water to make sure that the bacteria have died.
Cholera in itself is preventable and treatable, but the disease shows itself in acute diarrhea and can kill in 12 to 18 hours after the symptoms manifest.
What causes death in cholera is the dehydration and the salt imbalance in the body because of loss of fluids through a lot of diarrhea and vomiting. So the first measure in treating these patients is to rehydrate.
With most parts of the country experiencing water shortage and therefore ensuring that hygienic conditions are maintained is difficult, and most times the source of water is also questionable. But the danger also comes from food handlers. Not just those sold by vendors, but also those that are also found in hotels, restaurants and butcheries.
You are not in control of what you eat all the time, especially travelers. When you travel out there, you may end up having to drink water or eat something, eat in a hotel, and you are not aware of the conditions under which that food was cooked, or whether the salads and the fruits were washed well. So because of this, any traveler is at risk of cholera and other foodborne diseases. And this is because it's also transmitted by food handlers.
While in the long term, improvement in water supply, sanitation, food safety and community awareness of preventative measures are the best means of preventing cholera and other diarrhea diseases, a person can ensure their safety no matter where they are by getting an oral vaccine against cholera that can protect a person for up to 2 years.
Take the vaccine which is recommended by WHO, the oral cholera vaccine. This is a vaccine that is it's one of the few vaccines which does not have to be injected. It's an oral vaccine, and you simply put it in a glass of water and drink, and it's going to protect against cholera.
With sensitive international export for fish and other food items, the country risks losing out on revenue if for any reason it is suspected that the food can be contaminated. People
handling either fresh produce, fish, meat and so on in factories, the owners of the factories need to make sure that these people are vaccinated in cases where those factories are in areas which have the cholera outbreaks. That would really help.
Cholera can be prevented by maintaining hygiene, including washing hands with soap and water before eating and after visiting a toilet, and boiling drinking water, as well as washing fruits and vegetables. Mwendo Kyogora, KTN, for Health Digest.